Good morning, sir. My name is Molly, and I'm going to be your nurse for the day. I understand that you received news today that you may have the beginning signs of Parkinson's disease. I'm sure you must be feeling really uneasy about this, and I'm here to answer any questions and explain to you in detail about the disease process, what kind of symptoms you may be experiencing, what we can do to help you, and ultimately, what you can expect in the years to come. Do you have any questions before we get started? No? Okay then. I'll start off by explaining the disease process and how it will affect your body. You may have already heard of Parkinson's disease before, as its prevalence is growing. However, it is usually idiopathic, meaning we don't have a clear answer of why this disease process occurs in the body, and it also occurs spontaneously, as symptoms start to rise slowly and then patients begin to have worsening of those symptoms and then more of them. What we do know about the disease is your body has many neurotransmitters that play a huge role in how the body functions. In Parkinson's disease, dopamine and norepinephrine are the two neurotransmitters that are affected, causing the changes in your body. The neurons in your brain that transmit signals to other parts of the body begin to degenerate or stop working and die, causing the message not to reach its destination. The neurotransmitter dopamine is responsible for regulating physical, mental, and emotional functions. With those neurons not capable of firing and transmitting the message, the functions will start to decline. Norepinephrine is the other neurotransmitter affected, causing loss in proper functioning of the sympathetic nervous system. The sympathetic nervous system directs the body's rapid and voluntary response to dangers or stressful situations. With the loss of these neurons, the autonomic functions in the body, such as heart rate, blood pressure, digestion, and breathing, will have difficulty functioning as well. Do you have any questions so far?
There is no one specific test for testing for Parkinson's. It's usually based on medical history, neurological examination, presenting symptoms, and testing response to drug treatment. A neurologist will emulate coordination, walking, and fine motor skills. Rating scales, such as Hoehn and Yarn, and the Unified Parkinson's Disease Rating Scales, are used to measure an individual's mental capacity, behavior, mood, daily living activities, and motor function. These scales will help with the initial diagnosis to rule out other disorders. The scales also monitor the progression of the disease. Diagnosis is confirmed usually if the patient presents with the following. At least 2 of the 3 major symptoms are present: tremors at rest, muscle rigidity, and slowness. The onset of symptoms started on one side of the body. Symptoms are not due to a secondary cause, such as medication or stroke. Symptoms are significantly improved with levodopa.
The main symptoms include resting tremors in fingers, hands, legs, and head, bradykinesia, which is slow movement, which can affect facial muscles in combination with stiffness and can eventually lead to mask-like appearance. Stiffness of limbs and trunk may lead to pain. Impaired balance and coordination, which could lead to impaired posture, shuffling gait, change in speech, which means you would speak more softly, quickly, and possibly slur, loss of automatic movements such as blinking, smiling, or swinging arms when you walk. Other symptoms that go along with Parkinson's disease are cognitive impairment, difficulty swallowing, urinary problems, skin problems, trouble smelling, and possibly sleep disturbances. All these other symptoms can lead to depression, and the progression of these symptoms varies between individuals. There are 5 different stages of Parkinson's. Stage 1 is where there are mild symptoms that don't interfere with daily life. In this stage, tremors may occur on one side of the body. Stage 2, there are tremors and rigidity that affect both sides of the body. Stage 3 is slowness in movement, loss of balance, and in this stage, falls are more likely to occur. In stage 4, symptoms have progressed to severe and limiting the individual. Additional help may be required when performing ADLs. Stage 5 is the last stage, which is the most advanced and debilitating stage. Person can't stand and requires full-time assistance.
Well, sir, your risk for Parkinson's disease increases as you age. Generally, Parkinson's disease develops at around 60 years or older. And because you're a man, you're at an increased risk for developing Parkinson's disease over a woman. Also, if you have family history of Parkinson's disease, especially where one or more of your family members may have had it, then you are more likely to have it. Your risk is also increased if you've ever been exposed to trichloroethylene or perchloroethylene at extended durations of time. This may happen in a work environment, or it can be found in other household chemicals too.
Drug therapies for Parkinson's disease is aimed at correcting the imbalance of neurotransmitters in the central nervous system. Anti-Parkinson's medications create an enhanced release or increase in the supply of dopaminergic or antagonists or block the cholinergic neurons. Other drugs that are used, they're not really sure of the mechanism of action against this disease process, but they're NMDA. And these drugs are usually used as a first line because of the negative side effects of many other drugs. The gold standard for Parkinson's is levodopa. This drug is associated with dyskinesia, which is uncontrolled erratic movement, and also with periods where the drug suddenly starts working or stops working. This is preferred by some healthcare professionals in later stages because of this, and the belief that the effects might spontaneously wear off with longer use. During later phases of the disease, drugs can be used for particular manifestations of PD, like hallucinations, and these are mainly anticholinergics. If you are unresponsive to drug therapies, there are surgical options. These are different categories. There's transplantation, deep brain stimulation, and ablation. Deep brain stimulation is performed by targeting an area of the brain with an electrode. A generator is placed in the chest and delivers a specific current to that area. Ablation works by destroying a specific place in the brain that is affected by Parkinson's disease. This is not popular because it's not reversible. There is also clinical trials and research into transplantation of fetal neuron cells. This is supposed to increase the amount of dopaminergic cells, which you're trying to increase with Parkinson's.
Along with pharmacological and surgical options, there are lifestyle changes that you can make to help manage the symptoms of Parkinson's disease. Symptoms of the disease and side effects of medication make managing your diet very important. Avoid a diet high in protein and vitamin B6 as it blocks the effects of levodopa, both of which are found in high amounts in pork and poultry. You should increase your intakes of whole grains, fruits, and vegetables, essentially all foods that are high in fiber, to avoid the risk of constipation. Your risk of malnutrition increases as the disease progresses, so make sure that you are still eating foods that you find appetizing. It is also important to exercise. As the disease progresses, you will find it harder to walk and maintain balance. Exercising around 150 minutes a week, doing simple things like brisk walking or light yoga, will help to retain muscle strength and coordination. And in general, it's a good idea to get enough sleep. The disease can be very taxing on your body.
Parkinson's is a slow, life-altering disease that eventually takes over every aspect of the individual's life. Support and receiving treatment can help the individual accept the gradual loss of independence.